Welcome, my name is Dr. Thakiso. I'm a clinical research fellow with Dr. Farron here in St. Patrick's University Hospital, as well as incorporating St. Edmundsbury Hospital. I'm part of the dual diagnosis program, and the dual diagnosis program, the reason why it's called the dual diagnosis program is that we're here to help people that have two difficulties, be it a mood disorder such as depression or bipolar, or an anxiety disorder, some sort of mood or emotional difficulty that they may have. Some people have difficulties such as OCD, and in combination with this, some of the emotional difficulties leads them to cope through the use of substances, be it in the sense of excessive alcohol intake or over-the-counter opiates or benzodiazepine prescription medication, and hence because of this they have what we call a dual difficulty. And one of the ways in which we're trying to lead and better help the patients or clients that we have is by introduction of acceptance and commitment therapy. This is what we call a talking therapy, a third wave psychotherapy intervention, in which we're targeting people that particularly have difficulties with, say, anxiety or being aware of their thoughts with a dual diagnosis problem. And as part of the program, I'll be introducing my colleague here shortly, we've introduced a number of sessions within the week, within the 4-week program, that will be most helpful for those people that are involved. And of course, at times, sometimes everything is quite overwhelming. So these series of videos are to help people that are perhaps new to the groups or new to, indeed, looking and seeking help for psychiatry, to give them a better understanding of the difficulties as well as what we offer. So at this point, I'll be delighted to introduce my colleague, Ashley Curtin, who's a counselling psychotherapist as well as an ACT therapist.
Thank you very much, Steve. So as Thakiso mentioned, I'm a counselling psychologist, and the area that I specialise in are mindfulness-based approaches, and one of these is acceptance and commitment therapy, and we call it ACT for short. And I suppose the idea behind ACT is that every single one of us, myself included, struggles with unwanted mental experiences at times. So pretty much everyone has some version of the I'm not good enough story. I'm not blank enough, I'm not smart enough, I'm not successful enough, or whatever the case may be. And we also kind of struggle with unwanted emotions, so that might be around feelings of overwhelm, feelings of sadness, feelings of anxiety, maybe guilt about the past. And for many of us, if we get really kind of hooked by those thoughts and really caught up with those emotions, it can be very hard to kind of keep a focus on the things that matter most to us. So what ACT is really about is there's two different parts. One part of it is that we learn strategies to kind of learn to cope with these unwanted thoughts and emotions that come up for us. For example, sometimes when we have a thought like I'm not good enough, we can get really hooked by it. So if you could even imagine that your hands were like a thought that you didn't want, and even if you'd be willing to give this a go as you're watching this, and then just slowly start bringing your hands closer and closer and closer until they're suddenly covering your face. So you're so hooked by that I'm not good enough thought, and just trying to take a look around the room and just see what your view of the room is like. And for most of us, it's pretty blinkered. And just noticing if you can recognize times when you felt like this with a thought like I can't cope, or there's no point in trying again. So one thing that we do in ACT is we try to help teach people how to unhook from these thoughts. It's not about trying to make those thoughts go away, because one of the things we know is that, well, just say for example, just wondering how many times have you thought about a yellow Jeep in the last 2 weeks? And I'm going to take a guess that you probably haven't, because most people haven't. So this should be really easy for you. Don't think about a yellow Jeep right now. Don't think about what you would look like in a yellow Jeep. Don't think about I would look like in a yellow Jeep. And just be aware, if you're thinking I'm not thinking about the yellow Jeep, that's exactly what you're thinking about. And that it's the same thing with unwanted thoughts. So we have the thought like, oh, I couldn't be bothered trying, and we try really, really hard to kind of bring it down. And we often find that it even comes up even more. So one of the things that we do in ACT is that rather than try and put all of our time and attention in trying to kind of keep those thoughts down, a little bit like you'd be trying to keep a ball underneath the water, that the minute you let it go, comes flying back up. In ACT, we try to learn how to unhook from these thoughts, which a lot of people kind of find really helpful. And the other thing that we do with emotions that we don't want to feel, we try to keep them at arm's length. And if you'd be willing, just try and push it away, those kind of thoughts and emotions that you don't want. And if they're not going anywhere, try and push a bit further. Just noticing, is that emotion actually going anywhere? For most of us, it's not. What happens all of our time and energy? And I suppose the whole basic premise behind ACT is that if we're putting all of our time and energy and trying to get rid of the emotions that we don't want, we have very little time and energy left to spend kind of enjoying the moment, connecting with the things that really matter to us. So really ACT is about two things. One is about learning strategies to help us deal with our unwanted thoughts and emotions. And the other really big thing in ACT is that it's about connecting with the things that really matter to us. So what is it in our heart of hearts that actually matters? Is it our relationships? Is it our personal growth and health? Is it to do with kind of getting some sense of purpose through work, education, voluntary work, or whatever it might be? Or is it actually about getting a bit of fun, a bit of balance back in our lives? And for most of us, we don't know because we don't usually ask ourselves those questions. So ACT kind of gives us a chance to get out of our everyday life and actually get a chance to connect with, okay, where do I want to go from here? You know that old saying, if you always do what you always did, you'll always get what you always got. So ACT gives us that chance to kind of look at our lives, look at where we've been without getting overly hooked or kind of dragged down by it. Acknowledge where we're at and actually recognise where it is that we want to go. Because if we have an idea about where we want to go, we can kind of get some way closer to it. We might not get completely there, but if we were halfway there, would that be better than where you're at right now? And I suppose from my own experience, I've been running ACT groups for the best part of the last 2 years within St Edmundsbury. We started off with an hour and a quarter, now we have I think about 7 or 8 hours a week. And one of the things that people tell me is that for the first couple of weeks it's really, really confusing because often ACT is like the opposite of automatic pilot. So we're used to when we feel something, when we think something, we automatically do something. Maybe we automatically snap at people, or we automatically isolate ourselves, or we automatically pick up a piece of chocolate or pick up a piece of alcohol or whatever. So at the start it can be kind of hard because we're learning a different way. So usually for the first 3 or 4 sessions people kind of get a little bit confused and aren't quite sure. So if this happens for you, I just want you to know that that's really normal and natural. And really what we found now over the last kind of 6 groups or so is that pretty much the vast majority of people who completed the 8 sessions made significant improvements, that they improved their psychological flexibility, which we'll be looking at in another video. And the whole idea about psychological flexibility is that it's not that we'll never feel anxious again or that we'll never feel down again, but it's that if a situation comes up in our life that we don't necessarily want, that we're more able to kind of bend and adapt to that situation in the way that we'd really want to, rather than kind of feel like we're being pushed around by our thoughts and emotions. So that's what ACT stands for, Acceptance and Commitment Therapy. So how can we accept the things that cannot be changed so we can focus our time and energy on the things that really matter to us most. So I'll be handing you back over to Takisa. They'll be looking a little bit at how we're specifically adapting that to ACT for dual diagnosis, because there's a lot of research in this area to show that it can be really helpful with various kind of different aspects between addictions and also depression, anxiety, and also even just helping us just to kind of enjoy life a little bit more. Back to you, Takisa.
Thank you. And in the next video, we'll be looking at the research aspect of ACT in dual diagnosis. Thank you for watching.